This lecture is going to be kind of fun, right? So we are continuing to study the bones of the cranium, like we had stopped here last time. And the frontal bone was actually in your second test. Before, okay, it's not mine for sure. All right, so we're studying here more about the bones of the cranium, and then we're gonna look at the facial bones, right, and all the cool stuff that is involved with these bones. And some of these bones are so interesting. They have all these forms of these strange shapes with weird functions that you will have to know, right? Actually, there is a very appropriate function for one of the bones here that I guess I'll mention it when we get there. Okay. So we had looked at the frontal bone, and we continue with this bigger squamous part of the frontal bone, and then you have here the orbital parts. So these orbital parts are going to be like right on top of your eye sockets. Okay. So okay, that's your squamous part. That is the orbital part. Okay. So here, with the orbital part, you have subdivisions to it. And yes, the bones in your head, they're so complicated. It's like the most complicated bones in the body. So we do narrow down exactly what you need to know about those bones, right? And some of the things are very obvious because you can just deduce based on the bone name. So if you see something here that says supraorbital margin, so you know margin is like at the border, and then supra is on top, and orbital, of course, the orbits of your eyes. So you can assume that this is the part that goes on top of the orbits of your eyes. Okay. And also in this structure, you're going to find a little opening. So every time you see a hole, you call that a foramen, right? Some of them are big holes, some other ones are smaller holes. This one is kind of a small hole, and this is called supraorbital foramen. And it's important for, I believe it was nerves and lacrimal glands. Okay. So that structure is quite obvious. You see this opening here in the frontal bone on both sides, of course. So that is your supraorbital foramen. Okay. Another interesting thing here about this bone is that although it is one bone, when it was formed, it formed into pieces, and then these pieces fused. So you have this suture right in the front on top of your nose, and this is called metopic, like right in the middle. So metopic suture, and only involves the frontal bone. Okay, so that's a metopic suture. As we'll see, a joint that is made up of bones that are fusing in this zigzag form, that is a non-mobile joint. So it's kind of like a almost solid joint, and we call those sutures. Okay. So we're seeing the supraorbital margins, and there are some arches on top of the eyebrows. We call that supraciliary arch. Okay, I mentioned that foramen, the notch. Okay, let me see what is important here. Okay, so the lacrimal fossa, that is important for storing tear glands. So the lacrimal fossa is going to lead to openings here, and then you're gonna get tears through there. All right, so here you're showing the lacrimal gland. So it's one lacrimal gland here, and it goes through the supraorbital foramen, and that gets lubrication for your eyes on a regular basis. Okay. And you really overexert those glands, of course, when you're crying, right? And notice here that besides this lacrimal gland that is here at the frontal bone, you have another lacrimal gland. There's another lacrimal sac that is very close to your nose. So when you are crying, you have ducts that will direct tears to your eyes, but also direct tears to your nose. So if you notice when you're crying that your nose starts to drip, so those are not, boogers, they are actually tears. So you also cry through your nose. Maybe you never thought about that. But notice next time you're crying, hopefully not after some exam, not after these exams, you notice that your nose starts to drip. Those are actual tears, So looking more here at the frontal bone, so this is the top of the head, looking from the top of the head, okay? You see here this coronal suture, as we're gonna see more details about that. And you also have this other suture that is gonna connect other bones here, okay? But what do you call this other suture here? Sagittal suture. Okay, so on the top of the head, you're gonna have the crown, the coronal suture, and you're gonna have the one that goes back, that's your sagittal suture, right? So looking here back in your frontal bones, if you turn this structure to the other side, so you're flipping it over, you're going to see spaces here that are actually impressions here from the frontal lobes of your brain. Okay, so your brain frontal lobes are going to sit right there under your frontal bone. And you see that right in the middle here, you're going to have a protuberance of this bone, of your frontal bone, that is indicating like the separation of the two brain hemispheres. Okay, and this bone structure actually gives rise here to this sagittal sinus, like goes right in the middle of this frontal bone. Okay. So here is the frontal bone, and here is your coronal suture. Okay, and the coronal suture is going to be between your frontal bone and your parietal bones. So you have two parietal bones on each side. Okay. And okay, so let me see here. The parietal bones, they're going to join each other at the back of your head by that sagittal suture. Okay. So here another picture showing that coronal suture and then your sagittal suture. Now, if you keep on following your parietal bones all the way to the back, you're going to find that one occipital bone all the way to the back of your head. And the suture that joins your parietal bones to the occipital bone, you call that a lambdoid suture right here, because it looks like the Greek letter lambda. Okay, so you need to know sagittal suture, coronal suture, and the bones that are making contact for the suture. Okay. And then there are more sutures. Actually, in this slide, or maybe in the next one, I added a few more wordings that I didn't have last year that I find is important, is interesting information. Okay. So when you look here at the top of your head, you're going to find a bit of an indentation, a bit of a protuberance, and that is called a vertex. So the top of your skull, right when you have the, like very close to the coronal suture, you're going to have the vortex, okay? Now, when you look here at your parietal bone, and it's going to make a suture to another bone right here. Okay, so that suture is called squamosal suture. Okay. Now, okay, so the parietal bone is here, and this bone here that goes to your ears, also two of them, you call that the temporal bone. Okay, so this is the slide that I find interesting. If you look here at these sutures that are joining 4 different bones in your skull, okay, so you see here that a kind of a letter H shows up in these sutures. So you have here your coronal, you have here, what's the name of this suture right there? Squamosal suture. And here, like right in the middle, you have this this formation that is called pterion. Okay, so this is a small region in the skull, and actually, of course, all these bones are meeting. So 4 different bones are meeting. We didn't talk about this bone here yet, right? We only talk about frontal, parietal, and temporal. But this bone over here, that is the sphenoid bone, this is a very, very interesting bone that we're going to talk about later today. Okay, it goes actually across your head. So when you look at this age structure that is called a pterion, it actually happens to be a thin area of the skull. So clinical importance of this area is that if you damage the area, you can actually get a lot of bleeding from your meninges, and that bleeding can put a lot of pressure in the brain. So you can end up with hematoma that is within the meninges that can be life-threatening. You call that epidural hematoma. So this region of the skull is actually very thin and fragile area of the skull. What is emphasized here also is that at the backbone, so that's your occipital bone, you have only one of them, right? You have this little protuberance that is called external occipital protuberance. You can actually feel it if you go all the way the back of your head. You feel a bit of the bone that sticks out. So it's an important site for attachment of tendons to muscle. Okay, so again, your parietal bones, they're paired, right? So when you look at the important things about your parietal bones, you're going to find this type of formation that is actually called a temporal line. Okay, so this is a parietal bone, and this is very important for attachment of this muscle that brings up your mandible. Okay, so the mandible here is the only bone in your skull that that moves. Okay, so that's the only bone that moves. As I mentioned before, in some people it moves more than in others. One mnemonic that I use to remember which bone is that one that moves, right, is the mandible, mandible, right? So you can the mandible, right? So coming back here to your parietal bone, this formation right here is very important for attachment of that muscle. So the muscle is called the temporalis muscle, temporalis, and the job of this muscle is just to bring your mandible up. So crush your mandible. When you relax the muscle, then you can bring your jaw back down. All right, so looking at more bones here, again, you have your occipital bone. There's only one at the back. And you have this lambdoidal suture. We only see a little part of this here, but you have other pictures, you're going to see the whole thing looks like the lambda, the letter lambda going on the sides. And here is your first question. And let me put your confidence level on. And actually, I think this question was in your test, wasn't it? Okay, this skull bone is connected to the rest of the cranium posteriorly via the coronal suture. And what is the name of the bone? Yeah, a similar question, not exactly this question. Right? Okay, what is your answer? B, that's very obvious, showing your frontal bone. Ooh, 91% confidence. It should be 100%. Oh, we'll do better. Okay. All right, so let's look at other features here of the head. Okay, the big opening right there. Okay, this very, very big opening is called the foramen magnum. Magnum for big, foramen for hole. So the name of this thing is really the big hole, right? What is the importance of this thing? Is going to connect your spinal cord, is a passage for your spinal cord to connect with the brain. Okay, so your spinal cord is going to come through here and is going to connect to your brain. And that is on your occipital bone. Okay. The other things that are interesting here, let's see. All right, so here we are looking at a plane that is showing the inside of the head looking from the top. Okay, so here you see important parts that are for passage of the jugular vein. Okay, so we have more things here. Let me see. You have the jugular vein that is going to come from the neck and it goes to the brain. So here you see the jugular foramen right there. You have another opening here for your carotid artery. Okay, so actually it's artery. So jugular artery, carotid artery. And of course you have it in both sides and they're close to your big hole. Okay, and here you have other bones that are going to show also very important landmarks in the skull. Here is showing the cribriform plate, which is this part that is full of little holes. Okay, and you also find here an indentation that is the sella turcica that we're going to see next as well. Okay. Okay, so you find here your jugular foramen that is really between your occipital bone and the temporal bone, like looking from the inside. So those are landmarks that if you see those, you should be able to identify them. So interesting thing here about your occipital bones. You have those protuberances right there, and those are called occipital condyles. So you got two of them right here. And they're right at the base of the skull. An important thing about that is that it's going to connect the head, so the cranium here, to the first vertebra of your column, of your vertebral column. Okay, so this is going to be point of attachment of your head to your vertebral column. Ooh, and the head is turning around, so you can see from all the different angles those occipital condyles. All right, so this picture here, at first I look at it, I thought it was some kind of a Halloween type of picture, thinking those are the eyes and this is the head and then the teeth, kind of a strange way. This is really 2D, but you should be thinking about 3D. And what is happening here, you're really looking at the skull from the bottom. Okay, so these are not eyes, all right? Those are indentations, those that are seen from underneath of your occipital bone, okay? So looking from under, you're going to see a bit of a landmark here that is called occipital crest. So occipital bone, looking from underneath, you're gonna have this division that is the crest, the occipital crest. Here you see your lambdoid suture, lambdoidal suture. Okay, let's see here. Okay, so you have two other landmarks here besides the crest. You have here the superior knuckle line, and then you have the inferior knuckle line. Okay. So looking here, again, from a top view, of the head, you should know which one is the front and which one is the back. Okay, so when you look at these types of these landmarks and you see this bone full of holes, you should know that this is the front of the head. When you see the foramen magnum, you should know that this is towards the back of the head. Okay, so you should locate which one is where. And then you see this strange looking bone right here that kind of looks like a bat Pokemon. Everybody knows the Pokemon? I guess they're not very popular these days, right? But to me, that thing looks like a bat Pokemon. You know, it has the eyes right there. It's kind of not very happy face, okay? So this thing you call the sphenoid bone right here, okay? So things that you have to know about these structures here is that the brain is going to sit right there, okay? So you're going to have here some sitting places. You call those fossa. So you have ones that are in front of the head. Those are anterior fossa. And then you have ones that are in the middle of the head. You call those middle fossa. And then the ones that are by the occipital bone, you call those posterior fossa. Okay, so the brain is going to sit right there. All right, so here we go to the other front bones. Those are also a pair of them, so two of them. The temporal bones. These are going to be close to your ears. So there are important features about those temporal bones, and those are all irregular flat bones, right? So what you have here in the temporal bone, you're going to have a squamous part, that's the bigger part right here. Okay. Then you're going to have tympanic part, that's the part that goes, that you're going to have your ear holes. Okay. And then you're going to have a mastoid part that is under here, like and the back going down. So three parts for those temporal bones. Okay. Oh, another little bit of a petrous part. I always forget about that one. Okay, so here again, showing your squamous structure. This is the pink side right here. Okay, the squamosal. Okay, squamosal structure. Actually, the suture. Okay, so you should look at this and locate yourself where in the head you should find those landmarks. Okay, because there's so many names to remember, and sometimes it's a bit confusing. So you should, when you look at the name, you should have a good idea of where to find those landmarks. And one thing that is very pronounced, that is very easy to find, is part of those of the cheekbones and the cheekbone arches. Okay, so those are called zygomatic processes. Okay, so you're going to have a zygomatic process that is coming from your temporal bone, and you're going to have also a zygomatic process that is coming here from your zygomatic bone, and they're going to join. They're going to join in the middle right there. Okay. This whole arch here, you call it the zygomatic arch. Okay, so what is important here? The upper part here, you're going to have this other bone that is called the mandibula. Okay, so this mandibular fossa. Yeah, so this is when I get in trouble with my Portuguese and my English, because I learned the names in Portuguese and then I have to translate it to English, but they're more or less the same. They're all Latin based, right? So you have here your mandible. Okay, so if you learn that in Portuguese, that's a mandibula. Okay, and the mandible is the part that that bones that are going to hold your upper teeth. Okay, so that is close to your zygomatic bone, and then the zygomatic bone is going to be in connection here to your temporal bone. Okay, so it's important here. All right, so shape of the temporal bone. So you look something like this, and you should identify, oh, this is a part of the zygomatic process. It's going to make the zygomatic arch. Okay, you should identify here the ear canal. So you also call this external acoustic meatus. That's another name for your auditory canal. It's the same thing. Okay, so that's gonna be your ear hole. Okay. Okay, important things to know. Okay, mastoid process. I think I have highlighted there. Yeah. So your mastoid process is very important for attachment of tendons. They're going to go to the muscles, okay? And you're going to be able to rotate your head because of attachments of muscles to this mastoid process at your temporal bone. Another thing here, okay, your carotid foramen or carotid canal, important for your carotid artery. Okay, we mentioned that. So here is a picture of your carotid artery. So at first you're going to have a common carotid artery that is coming here from your aorta. And then at the neck, you're going to divide your carotid artery into internal and external. So the foramen we looked at has to do with this internal carotid artery that goes to the brain. Okay, so here we go to this fun bone. So this is your sphenoid bone. You're not really going to see a lot of it if you're looking from outside of the skull. So you're going to see just a little part here of your sphenoid bone. And the interesting thing of this is that it's going to go all the way across and it's going to be on the two sides. So you have one sphenoid bone. Okay. Now we have better, okay, so this is a better image of that sphenoid bone. Okay, so it goes all across your head, and this is the guy. Well, here is even a better picture of that Pokemon. Okay, so here the Pokemon got the open mouth or big nose, and you got the little eyes over here, and it has some big bat wings, and then from another angle you're gonna see smaller bat wings. Okay. And there are several important characteristics of this bone. I'm going to look at them, what's important to know here. So here I have a little movie.
Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and two pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland.
So important thing about this bone, okay, it goes across the head and it has that sella turcica.
Other bones become more visible.
Okay, all right. So here, your sphenoid bone, okay, so this sella turcica is also called hypophyseal fossa, okay, because your pituitary gland is also called your hypophysis, okay, hypophysis gland. Now the sella turcica right here is going to be a little seat for your pituitary gland. So the pituitary gland has two parts here. So it has the anterior and posterior part, and it is connected to your hypothalamus. Okay, so hypothalamus is like right there in the brain, and then the gland is just connected here by this stalk, and the pituitary gland is going to sit in that little sella turcica. All right. So if you look at your sphenoid bone, you're going to find here that that little seat that is your sella turcica. So I put a picture here of how this thing got named, because some people thought it looked like the saddle of the Turkish saddle. So that's the name of that thing, is the Turkish saddle. Okay, cella-torsicle. Okay. Our important feature, also another important landmark of your sphenoid bone, is you're gonna find those little holes right here, like the eyes of the Pokemon. That is actually for optic nerves to go through. Okay, so your eyes are right in front of your sphenoid bone. Okay, you see here your eye orbit, and then here you're gonna have your optic nerve that is gonna go through that little groove here. That is your optical foramen. So the opening is a foramen. The groove is gonna lead to that opening. Like right there. All right. So important thing here about the sphenoid bone, important landmarks of your sphenoid bone. You're going to have here your optic foramen, also called canal, right? Optic groove right here. Okay, so optic canal, optic groove. What else here? Cella-torsicle. Okay, it's right here. You have the big bat wings. You have a greater wing. And you're going to have a smaller ring, so they call that those on the top here, the lesser wings. Okay, so on both sides. Anything else important here? Okay. So you have two important processes. You have the posterior clinoid process that is going to lead to your big wings. And then you have your anterior clinoid processes. They're going to be leading to your lesser wings. So two processes, and they both lead to wings. And here comes another question. That's an easy one. Which of the following structures serve as the seat of the endocrine system by supporting the pituitary gland? So that's an easy question. Yeah? Sorry? Oh, those iClicker glitches. Okay, well, how many people couldn't answer? Okay, a lot of people. All right, so I'm going to open it again. Those of you who answered, do not do the double dipping. Okay, I'm going to open again. Make sure you're ready to answer. Hopefully everybody who did not answer will get it this time. Working? Okay. No double dipping. Okay, I'm going to stop it. What is your answer? Yeah, that's the D. If everybody got the points. Okay. All right. And then we get to the fun one, your ethmoid bone. Okay. That bone is one bone, is right in the middle of your head. Okay. And it's going to be part of your facial bones. Okay. And it's going to be like right behind here, right behind your face. Is going to be part of your orbit of your eyes. Okay. And is also going to be part of the bottom of the cranium right here. Is going to be sitting, is going to be in direct contact actually with your brain, right? Is going to be making a part of the structure of your nose. So the nasal septum is going to be part of your ethmoid bone. Okay. And you're going to have some sinuses that are going to go through this bone, and they're very important for warming up the air. So you're going to have nasal cavities that are going to go like right there, right at the bone will actually make the cavities. Okay, so here is showing your ethmoid bone. Is also like in the center of your head. Okay, so let's look at this video right here showing your ethmoid bone.
Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass.
Okay, so I have a lot more to talk about this bone, but I need to take, continuing the story. If it looks like I'm stressed, it's because, yeah, I am. And what happened here with this ethmoid bone story? Let's look at the structure of this ethmoid bone. You see those little holes right there? Oh, okay.
Located between the orbits, the ethmoid bone makes up a portion of the cranial floor.
Okay, so be quiet. All right. So you see those little structures right at the base, at this cubiform plate. You see that there are lots of little holes right there. You see the little holes? Those are direct connections from this nasal cavity, like all the way to your brain, okay? And we can use that as, nerve endings. So your olfactory nerve connects straight from this area straight to your brain. You can use that as delivery of a passage for smells, right? So you have receptors that will notice different chemicals that gives you the sense of smell, and those olfactory nerves will transform those signals into electrical impulses and allow you to sense different types of smells. On the other hand, there are certain molecules that can be delivered, like certain drugs that can be delivered straight from your olfactory nerve straight to your brain. Example of those drugs is ketamine. You have heard of ketamine? There's a horse anesthetic. It's also used in emergency settings as anesthetic drug. Okay, so it's a numbing type of drug. And there are some other drugs that you probably have heard about, some kind of illegal drugs like white powders. Some people use like little, straws, and you go sniffing the thing, and the thing goes straight to your brain, right? On the other hand, there are some less illegal drugs out there, and this is when I said, well, I don't totally blame my last class students, because my students will not do this type of things, but if you stepped, anybody here for my last class? Okay, don't raise your hand. Okay, so anyway, if you go through those stairs and you get to the auditorium, my goodness, that smell of typical. So you smell the thing and you're like taking it as secondhand smoke. I was actually a bit worried of having to teach this class after that class, because after that class I'm like, hey, everything is cool. And it's like, oh, that kind of bone. Which one was the bone? Oh, the ethmoid bone. And the way these drugs made the passage straight into my brain. And I have to teach. Maybe I should not breathe when I'm going through the hallway. How can they study after this? But that's what happens, right? Straight passage into the brain. And I'm like, okay, I'm not worried. Oh, wait a minute. That thing is going to activate some kind of reflexes in the body. And we didn't even get to the nervous system yet. But yeah, it goes through the cribriform plate. So let's remember this part so far, right? Hopefully you are not as sensitive to those reflexes. Yeah, it's not fun. But it's definitely very relaxing. So when I'm tensed up, I'll just go through the hallway and I know where I'm going to get relaxation. Just kidding. So that's your little ethmoid bone with the cribriform plate. And there's more interesting stuff about
Located
this bone.
between the
Again, okay, so here, located between our ears. Okay, so cribriform plate right here, those little holes is because you have nerves that will go up to your brain, direct passage, very, very quickly, okay? And you're gonna find in this ethmoid strange bone, you're gonna find this little thing that you call the crista galli. That's your olfactic nerves, right? The olfactic nerve, when you have a cold, you know that a lot of times you lose the sense of smell, right? And then when you had the pandemic and you had the COVID, then a lot of us lost the sense of smell for a very long time, right? Actually, losing the sense of smell was one of the first symptoms of having COVID. So the nerves themselves, the olfactic nerve got damaged by the virus. And a lot of times it took a long time for the nerves to recover. So the olfactic nerve is actually one of the only nerves in the adult that will recover after being damaged, especially from viral infections. Now, what happened with COVID, sometimes we would not recover the sense of smell until like 6 months after recovering from the viral infection, right? And with that, you also know that you would lose a lot of the taste, of the sense of taste, right? So you would not smell much, you would not taste much, so everything you would eat would taste like cardboard. And part of the reason was that your olfactory nerves were damaged. So did anybody like go through that, like no taste, no smell, like forever? It took up to a year for this thing to recover. And I saw also with my uncle that he was in a very, very severe case of COVID, but yeah, he recovered, but he was complaining that everything tasted like cardboard for over a year. So like no taste, no smell whatsoever. But those olfactory nerves, they do recover. So eventually you will recover your sense of smell. So that was the one thing that I wanted to say about that. Okay. More interesting things here. Here it is. You're going to find here all those areas of empty space. You're going to find mucosal tissue that is surrounding the bone. Okay. And you're going to find these formations, these indentations, these protuberances that are very important for warming up the air when you breathe, and also to make it humid, humidifying and warming up the air. So you're going to see here in this huge sinus, you're going to find this turbinate type of concha. You call those sinuses, you call the nasal concha, okay? Or in Portuguese, conchas. So here you're going to find in this ethmoid sinuses, so you call them ethmoidal, actually ethmoidal sinuses, you're going to find all these protuberances. They're called nasal concha. And a main function for that is to increase the surface area of this cavity. So you're going to have the air that is coming through your nose is going to get humidified and is going to get warm. So by the time it goes to your lungs, through the esophagus and through the lungs, it's going to have a certain humidity and a certain temperature. And for us here in South Florida, this is not really useful because it's always warm outside, right? But if you go to places that are very, very cold, like up north or way down south, right? And the air is very, very cold, you don't want to be breathing this very cold air straight into your lungs. So Harry Potter here is calling me. So you really want to humidify and you want to have a certain temperature that's not going to like really, really give you a temperature shock to your lungs. So that's the function for your nasal concha or concha. Okay. Okay, so now you're going to see some other bones that are part more of your facial bones, right? So here, right in the back or on the top of your mouth, you're gonna have the vomer bone. So this is gonna be part of the facial bones, and you're gonna also have the cartilage that is going to make part of your nasal bones. So part of the nasal septum. The septum is right in the middle of your bone. So parts that you should know here. Here is your cribriform plate of the ethmoid bone, so it's right on top of your nose, right inside of your nose, right? And you're gonna have here your olfactory nerves that go straight to the brain. The brain is sitting right there, okay? This is your frontal bone sinus. So sinuses are empty spaces, like actually they have air, it's not totally empty. So empty spaces that make the bones lighter in weight, so they're not as heavy, okay? So here you have your sphenoid sinus, and here you have your frontal sinus, okay? Other parts to know here. Okay, perpendicular plate of the ethmoid bone. Okay, so here mainly you're gonna have the overall naming of your facial bones, and yes, there are lots of bones, but they should be you should be familiar with the ones just by looking at their names and knowing their locations. Okay, so looking here at the nasal bone, of course, right on top here of your nose, and that's the part that is not made of cartilage, so this is a real bone. Okay, so you have your nasal bone. Right behind the nasal bone, you're going to have your lacrimal bone. So this is the part that you're going to have also lacrimal glands, so right behind the nose, okay? And palatine bone is going to be right on top of your mouth, and that is a bone that can have some form of birth defects in case of lack of folate acid during the pregnancy. Okay, we're going to have more slides for that in the next class. All right, zygomatic bone, that is going to be part of your cheekbones. Okay, part here of your cheekbones. And then you're going to look here at the maxilla. So the maxilla, there are two of them. Okay, they are fused in the middle, fused right in the middle of your face, and those are very important for holding on to your teeth, okay, the upper teeth. Okay, so your maxilla, and what else is important here? Of course, your mandible. That's of course the only part that moves, right? So mandible is also the jaw. So let's see here. Zygomatic bone. Of course, you have to know your zygomatic bone. So positions of the bones that you should be familiar with, right from the side view. You should find your ethmoid bone. It's right in the middle, right? You're not going to see it. It's right in the middle. Of course, your nasal bone. Okay, thing that I did not mention before, alveolar processes. Those are important for attachment of your teeth to the bones, okay? But you know that they are not, the teeth are not fused to the bones. You have connective tissue. There is a very tough fibrous connective tissue that are going to attach your teeth to the bones. And those are not really cemented in, right? They are a bit, they have a bit of flexibility. And proof for that is that sometimes when our teeth are not in perfect alignment, you can use braces to move those attachments and move the teeth in a better position because those alveolar processes are not really cemented in, so they're not fused. You have a bit of a movement with those sockets. Okay, so as I had promised you, this is kind of a short class, so we only have 38 slides for this. And with that, do we have questions or comments? I have also one comment concerning here. Let me go